When I look at a wound and I see a wound that is mostly granular, no deeper structures exposed, a nice healthy wound bed, but it's still open, that's a wound that's perfect for dermagraft therapy. My name is Dr. Lee Rogers from the Valley Presbyterian Hospital. I use dermagraft daily. People talk about the epidemic of diabetes, but really diabetes is a pandemic. It's sweeping across the world. When we look at the world statistics, we know that the prevalence of diabetes is on the rise. You look specifically at the United States, and most recent statistics from the Centers for Disease Control and Prevention show that 26 million people in the United States have diabetes, and an additional 79 million more have pre-diabetes, which if you add those numbers together, that's an astounding 1/3 of the total population in the United States. Diabetes is a costly disease, and it's a big burden on patients, on the healthcare system, and on the financial system that's associated with the healthcare system. We have a multidisciplinary practice where doctors of different specialties come together, and we concentrate on a podiatry and vascular surgery approach, because we know how important circulation is in the healing of diabetic foot ulcers. And we have a unit here in Los Angeles in the San Fernando Valley that's 8,000 square feet, 22 rooms. We see about 30 to 40 patients a day. So patients typically come to a place like ours with an infection. They'll be referred by another doctor or from another hospital. We'll make an initial evaluation. You have to treat the infection first. Once the infection is under control, that's where our vascular surgeon steps in and performs any number of tests, and they determine how much flow there is getting to the foot. When we understand then secondarily how much circulation there is, we can perform some type of intervention to improve that circulation, and that's necessary in a majority of cases. Then you want to do something to shallow that wound out, which is ultimately wound closure, and that would be applying a bioengineered tissue like dermagraft. Dermagraft has living cells, and these cells are fibroblasts. They're on a bioabsorbable mesh. The benefit of using a cellular therapy, there are multiple growth factors that are available to the wound. The wound is going through multiple stages on its way to healing. The first important step of dermagraft is when to use dermagraft, and that's in a wound that is granular, is vascularized, and does not have any infection present, and a wound that you and the patient have had a discussion about, and you've decided this is how we're going to take the pressure off of the wound, and you're committed, the patient's committing to you that they're going to come in for a weekly therapy like this. There are two things that set dermagraft apart from other products. One is the product itself, and the second thing is the support that the company gives you for their product. You also have a strong support network. We really have no problem with reimbursement when we use the insurance verification process, and that helps us to quickly assess whether the patient is covered or not for the therapy. You have your various doctors of different specialties. You have your nurses, you have your physical therapists, but we also have our dermagraft reps. We encourage our physicians in these wound centers to have contact with their reps, because it's really a partnership. Patients are really excited about an advanced therapy like this. They don't get it in every location because certain doctors may not know how to use it. And so when they come to a wound center, they expect a higher level of care. They don't understand all of the factors that go into healing a wound. And this is on the patient side, but it's also on the doctor's side. And so if we can overcome apathy through advocacy, then we'll go a long way in getting wounds to heal.